The following is an FGTV special presentation.
Hello, I'm Nazira Dawood. I'm the Health Promotion Program Manager at Fulton County. Today we're going to talk about asthma in Fulton County. There are several pieces to the diagnosis, management, and prevention of asthma and the triggers. Asthma is a complicated disease. We're going to discuss the prevalence in Fulton and what the health department has undertaken to address this chronic illness. I have the pleasure of introducing an esteemed guest who has strived to bring asthma to the forefront and address it along with the community. Richard Johnson, co-chair of the Asthma Coalition. Welcome, Richard. Thanks for being here.
Thanks, Nazira. I appreciate the opportunity to bring some of the work that the Asthma Coalition has been doing to the community in this format.
So, Richard, tell us about FAIR. It's also called the FAIR Coalition. Tell us who the FAIR Coalition is, what does it do, and give us a brief history of how it came to be.
The FAIR Coalition started about 2.5 years ago as part of the Department of Health and Wellness's bringing together coalitions to handle a number of the health problems that were prevalent in Fulton County, such as diabetes and women's health, and asthma was being one of the chronic diseases that affects all the health of Fulton County. So we started out with a large seminar bringing together about 120 people out of a number of the different agencies in Fulton County, from the Departments of Health and various others that affect asthma, and had a panel discussion. And out of that grew a coalition of independent people within the community that are working, that can affect asthma in some way in their day-to-day activities. And from that, we began having weekly meetings, and we've begun trying to educate the community and help the community better understand asthma to reduce the incidence of asthma in Fulton County.
Great. Richard, I've always liked the way you've described a coalition. Can you tell the viewers what do you mean by a coalition?
A coalition is the coming together of various people in the community who are doing work in their own areas of expertise, but they tend to overlap. In the case of asthma, for instance, you have medical professionals doing treatment work, you have people doing inspections in homes, you have HVAC contractors that are affecting the indoor air quality in homes. And what we've tried to do is to bring together those people that have overlapping interest and coordinate those things that can be effective in terms of reducing the incidence of asthma in the community.
Sure. So an asthma episode described by a common person, they say it feels like a sumo wrestler sitting on the chest and it's so hard for them to breathe. Can you tell the viewers what is an asthma episode actually?
Well, I've had the unfortunate experience of having asthma in my entire life. I don't remember a time when I didn't have asthma. Asthma is a chronic disease where you have it's the effect of like an inflammation on the airways in your lungs. And so as a result, you're not getting a good transmission of oxygen into your body, and you're laboring to try to breathe, which eventually feels like there's some extraordinary weight on it. But ultimately, it's a difficulty of being able to breathe satisfactorily and being comfortable in a normal way.
What are the common symptoms?
Well, a common symptom would be that you have tightness in your chest, and you get a wheezing. You wind up building up phlegm in your lung capacity. You can be tired. You can be lethargic and not feel like doing anything. It can also affect you in other ways of affecting your immune system, and therefore making you more vulnerable to other kinds of problems, colds and that kind of thing. You don't feel like getting good exercise. Exercise is laborious because of the capacity for your lungs to replenish themselves.
Okay, so let's talk about asthma in relation to Fulton County. We know 1 in 12 Fulton County residents are suffering from asthma. Give us more statistics on the prevalence of asthma in Fulton, and also tell us the goals of the FAIR Coalition. What is it doing to bring the prevalence down?
Well, there's about 85,000 people in Fulton County that are believed to be suffering from asthma, and they have various degrees of asthma. Some of them are an intermittent thing, and some of them are quite serious. Of that, about 25,000 are children, and they are of particular concern because their immune systems have not been well developed. And as a result, when they have an asthma episode, it makes them far more vulnerable to other things. They're more likely to be hospitalized, and certainly the cost of medicating them is more difficult. And there are things that during their development, while they're developing their immune system, that can affect the onset of asthma. And so we're particularly focused on the children in Fulton County. From a financial standpoint, the Fulton County subsidizes a good deal of health care in Fulton County. And they spend something in the neighborhood of $8 million a year on emergency room treatments and up to $16 million a year on hospitalizations that are associated with asthma. From a statistical standpoint, for all of the residents of the county, estimates vary between $60 and $150 million a year is spent by asthmatics. In some cases, families might have 2 children or more that are susceptible to asthma. And so the financial burden on them can be quite significant.
Can you tell us the goal of the FAIR Coalition, and also what are the focus areas that you guys are addressing?
Well, our goal is that we believe there are things that it's preventable and it's treatable. And we believe that as much as 60% of that cost can be reduced through proper knowledge of how to respond to an asthma episode, as well as how to prevent the triggers for asthma. There are things that set off an asthma episode that kind of cascade in your system to make it worse. And we've broken those triggers down into 3 primary categories that feel like that they can adversely affect asthma. One is airborne triggers, things that you breathe. Now, one of the most common things that everybody talks about is mold in the home and mold spores. And mold spores are certainly something that can happen. They can cause an allergic reaction, just like if you were eating something that was that you were allergic to. That can cause restrictions and exacerbate the asthma, inflammation in the lungs, in the air passages, and cause to trigger an asthma event. So air is a real critical thing, obviously. We're now finding a lot more data about the amount of particles in the air, not only just mold spores, but just regular background particulate in the air. Some of the studies that we've seen and participated in suggest that the indoor air has 1.5 to 2.5 times the kind of particles count that we find in the outdoor air. Another area that we're working on is surface triggers. And surface triggers would include things like common house dust. I mean, good housekeeping is a real big part of this. But it can also include things like dust mite detritus, that is a common trigger for asthma. Also, if there's other kinds of insect infestations, the debris from that can be inhaled and cause a problem, as well as any kind of rodent problems, pet dander. All of those kinds of things can be on surfaces and get stirred up and eventually be able to be breathed in. So that's the second area. And the third area that we're focused on is in dehumidification. When humidity gets up over 50%, it provides an environment where mold can grow. You know, you get in the summer times here in Atlanta, it's oftentimes 70-80% humidity when you bring it in and bring it down to room temperature. And that's more than enough for mold to grow in your carpets and even on the surface of many of your belongings and the walls and that type of thing. But humidity can affect a lot more than just the mold spores. Humidity can affect insects, for instance, that attracts insects. If you can hold humidity below 50% or around 50% in the home, dust mites, for instance, absorb the humidity through their exoskeleton, and there's not enough humidity left for them to exist, and it tends to reduce those. In the same way with other kind of rodents. So those are the three things that we're focused on in the Asthma Coalition from the prevention side, and that's the airborne triggers, the surface triggers, and the humidity control. The fourth thing that we're focused on is treatment. Treatment, there are so many treatment options available today. If treatment starts early and is done in a preventable way, it can drastically reduce the consequences of it so that we can be below the threshold where it requires emergency intervention or hospitalization.
So is that the treatment committee that you're talking about? The fourth?
Yes.
Okay.
My co-chair, Danella Abdul-Bar, is focused on the treatment committee. And one of the things that we found in the medical community is that they're focused on the treatment, and then they send people back into the same environments that have caused them to have a problem to begin with. Likewise, people are in environments and they don't necessarily know what the treatment options are available to them, and they go too long before they seek treatment. So one of the focuses of the treatment committee is to have a good asthma plan to say you have certain threshold points.
When we come back, I'm going to ask you the ultimate question, so let's go for a break.
The following is an FGTV special presentation.
Welcome back. We're joined by Richard Johnson, who's the co-chair of the Asthma Coalition, and I am Nazira Dawood, the Health Promotion Program Manager. Richard, in our previous section, you talked about the coalition, how it was formed, the history, and all that. But throughout the years, we've worked on asthma, and we've heard most of the outdoor air being mentioned and the efforts being made towards the outdoor air. So tell us, why hasn't the prevalence of asthma come down, or the trend of prevalence hasn't come down yet?
Well, as you know from our previous discussions, asthma has increased some 400% since the first Clean Air Act was passed in 1955. And since that time, there's been multiple other Clean Air Acts that have continued to reduce the pollutants in the outdoor air. And by any measure, the outdoor air has improved. Very little has been done with respect to the indoor air. Following, and it's our view that the indoor air is a big part of what's happening for the affecting of asthma. Following World War II, we started changing our housing habits from building homes with plaster walls and hardwood floors to having carpeting and having drywall. And as time goes on, that carpeting can wind up absorbing a lot of asthma triggers. We find all kinds of things in the carpet. Carpet is not necessarily your friend when it comes to breathing difficulties. And the cellulose in the walls, similarly with the elevated humidity here in asthma, it provides a good media for certain types of mold spores and other kinds of things to grow in and live on that weren't prevalent when you had plaster. So we feel that the materials themselves have a good part of that. And then on top of that, beginning in the late 50s and early 60s, we started becoming more energy conscious. And this really took off at the time when the oil shock came in 73 and 74. And so we've tightened up the envelope on these homes, wrapped them in Tyvek where they can't breathe properly, sealed up any kinds of cracks and seams with caulking so they don't breathe like they used to. So the outdoor air that we're cleaning doesn't get all that much outdoor air in, and the things that we create indoors don't have a chance to get out, particularly with respect to humidity. Following that, there were a number of studies that expressed concern about what was happening by tightening up the envelope, and this was the era where the sick building syndrome name was coined. And it wasn't until 1990 that we really started to focus on the indoor air quality. Out of that period of study came what was called the ERMI study. It was sponsored by the Environmental Protection Agency. And what they did was they took carpet dust samples and they analyzed it, and they were looking for different types of mold spores, and they were using that for a surrogate of a lot of other kinds of potential health problems within the home environment. And what they did is they found that if they had a certain elevated level of some mold spores compared to others, you had a more moldy home or a more of a problem home than other homes. A seminal study that was done out of Cincinnati's Children's Hospital used that subsequently in the 2007, 2006, 2007 time period. And what they did is they separated homes of people that had high ERMI value homes and into two groups of children that had been either emergency room treatment or hospitalized, emergency room treatment twice or hospitalized once in the previous year. And they went into half of the homes and they cleaned them up and they took care of the moldy materials and they did the other things to make the indoor environment healthier. And in the 10 months following that study, there was a 10-fold reduction in the amount of emergency room treatments in the number of homes that had been treated compared to the ones that had not.
That's amazing. So I see that the Asthma Coalition is focusing on indoor air, and sometimes it makes sense because we are most of the time indoor than outdoor.
Recent studies suggest that since the 50s, when that first Clean Air Act was passed, we used to spend about 40% of our time outdoors. Now we're spending 10% of our time outdoors and 90% of our time indoors. Tim Coons, who was the head pulmonologist at Emory for a number of years, gave me a perspective on that. I was frustrated because people weren't focusing enough, I felt, on the indoor air where we're spending 90% of our time. And he pointed out, he said, well, look at it this way. He said, some of that air comes from outdoors. He said, and so where do people spend 90% of their time breathing the air that we're trying to clean up? And that's in the indoor air. And it's certainly going to be a lot easier to clean up the indoor air in a single home than it is to try to clean up the indoor air in an entire city, or the outdoor air in an entire city.
Definitely. I would definitely like us to mention Brennan Passens and Kellen Edward Bolden, who passed away because of complications to asthma in the past 10 years. Brennan passed away in 2011, actually this October 10th, 2011. So her mom's testimonial has really helped our coalition bring an emotional side that communicates with the common person.
Yes, certainly asthma is a very personal thing. It's not like you go out into society and we talk about some general thing that affects everybody. When it affects you, it affects you very deeply. And in the case of Brennan, what happened with her is that she did have she had medication and things that were appropriate for treating asthma. She was known to have asthma and all that. But there is certain people who have adverse reactions to some of the medications, whether it be an allergic reaction or whether they call it anaphylactic shock. And in some cases, medications, and it's not just asthma medications, others have on the box a warning called a black box warning that says that some individuals can have this anaphylactic shock as a result of it. Brennan, unfortunately, was a person that suffered in that way. And she had come home from school and taken her medication and told her mom, gee, Mom, I'm not feeling well. I'm having trouble kind of breathing. Her mom, in a desperate effort, ran took her to a location where there is an ambulance and sought health care at a firehouse. By the time that they got her to the hospital and appropriate medical care, she in fact died from it. And so that's one of the faces that we use to really drive home the importance and the risk that people have that do have asthma and suffer from asthma.
So we do actually acknowledge Sarah Passens and Rhonda Mitchell for being in the forefront, actually taking our message to the community.
Yes, her son, Ms. Mitchell's son, was an athlete, played football in school, and had an asthma episode at school, and by the time they got proper help to him, he also passed away.
Okay, thank you, Richard. So tell us what are some of the successes that the FAIR Coalition has, and what are some of the challenges that you go through, and do you think this is a good marriage between the health department and the coalition in working together to address asthma?
I really think that our biggest success is the ability to bring together people that all have a part of the problem and be able to coordinate their efforts. The medical community, for instance, has been focused on treatment, and the pharmaceutical community has been focused on their medications and making sure that they're filling the prescriptions properly. The people in the housing authority are looking to make sure that the houses are kept clean, and people in the schools are trying to educate the children about these asthma triggers and things. But they're all individual, as you've referred to them in the past, as silos. And we've been able to coordinate that. So now the medical community is beginning to say, hey, you're having these symptoms that are consistent with problems that might be in your environment. We really need to get an environmental assessment of your home as well as doing these medical tests that we're doing. And the people out in the field that are saying, hey, we're finding these things in the home that need to be taken care of, and we see that your child is having these kind of problems. We really need to have an asthma plan for them and see to it that they have access to the appropriate medical care. And so in trying to bring together the information and things like the HVAC system people to understand the importance of filtration so that when they're talking to their clients, they can give them the options and the importance of it. So I think that is the biggest success that we've had. We've done it not only on a one-to-one basis in the medical community, but we're also distributing information throughout the general public about this through the school systems, through the pharmacies. We've distributed some, I think we're up to 30,000 brochures now to talk about those kind of events.
Sure. So I see the main key points that you're talking about is collaboration, partnership, integration, and coordination.
That's
for
correct.
Success.
That's correct.
Thank you so much for your time and expertise, Richard. And we wish you success in addressing the causes of asthma in Fulton and beyond. If you'd like to be a part of the FAIR Coalition, please call us at 404-613-1243 or visit our website at aaronlungs.org. That is AARONLUNGS.org. Thank you.
And thank you for giving us the opportunity.
Thanks, Richard.
You're welcome.
You've been watching an FGTV special presentation.